Hello and welcome to this conference on acute glomerulonephritis, also referred to as AGN. My name is Kay and I have studied extensively in this specialty of renal diseases and will be directing this conference. During the first part, I'm going to be directing my questions to Jessie, who will share a brief description of the disease and some signs and symptoms and who's at risk. For the second half, I will direct questions toward Belle on the organs and organ systems that are affected and what assessments are important to look for when caring for a patient with AGN. So to start off, Jessie, can you tell us more about what AGN is?
Yeah, absolutely. So acute glomerulonephritis is a disorder that occurs where there is inflammation and damage to the glomeruli, which is this cluster of capillaries around the kidney tubule that filter waste from the blood. So the damage to them and inflammation causes this decreased waste filtration. So that decreased waste filtration also leads to loss of vital substances that our body needs. A main one of them being albumin, which is a protein in our blood. So albumin is a protein that's produced by the liver that's in our blood, like I said, and transports vitamins and hormones throughout the bloodstream, and also maintains the oncotic pressure within the bloodstream, which keeps fluid from going into the areas that it shouldn't, such as our extremities and peritoneal cavity. So acute glomerulonephritis differs from chronic glomerulonephritis in that damage and symptoms occur more suddenly, and they're usually a result of an ongoing or prior bacterial or viral infection, whereas chronic is just always going on. There's damage that occurred that isn't reversible or due to a secondary cause. Around half the cases of infection-associated AGR are caused by strep and staph infections, although there are many other bacterial and viral causes, such as Hep C, Hep B, and HIV infection.
Thank you so much for that. So now we know that it's important to catch AGN early and to start treating it early. Because as we discussed, the damage of the kidneys causes a loss of important substances such as albumin, and it decreases blood filtration. But what are some signs and symptoms that we are looking for?
Yeah, so some of the general signs and symptoms that we're looking for are that the patient might experience are weakness, abdominal pain, and fever.
Thank you. So what are some other specific signs and symptoms that we might see?
Yeah, so some more specific signs and symptoms we might see due to the decreased filtration rate. We'll often see proteinuria, which is high levels of protein in the urine, and hematuria, which is blood in the urine. That gives the urine a dark cola color, so a lot of times you'll see that as one of the number one or main signs to key you in. As we talked about, we'll also see a loss of albumin, which is that main protein in our blood. So with the loss and decrease in oncotic pressure, we'll see a fluid shift from the bloodstream into the surrounding cells, so in the peritoneal cavities. This is why in our patients we oftentimes see a lot of pitting edema or peripheral edema or swelling of the arms and legs, and we might also see swelling of the abdomen, also known as ascites, due to fluid in that peritoneal cavity. Ascites is especially dangerous and needs to be treated right away if you see it, because the excess fluid will put pressure on the abdominal organs and can lead to infection or trouble breathing. Patients with AGN also have hypertension often due to the decreased filtration rate of the blood in the kidneys. And hypertension is important to treat because if left untreated, it can lead to heart disease and stroke. The hypertension also leads to even more edema, and oftentimes the patient's face and eyelids will also swell when they have really severe symptoms. So all of these are important things to look out for in our patient assessment.
Okay, thank you. So as you mentioned before, AGN has multiple causes, but who do you think is really at risk?
Yeah, so as you said, we talked about AGN has multiple causes. So anyone who had recent bacterial or viral infection is technically at risk. However, there are some people that are more at risk and at more risk of developing acute glomerulonephritis. It increases greatly if the patient has a weakened immune system, is immunocompromised, or is taking medications that are immunosuppressants. Patients with high blood pressure that normally have high blood pressure are also at greater risk because the constant high blood pressure increases the filtration demand and damages the kidneys. And the damage to the kidneys is one of the reasons that you see acute glomerulonephritis.
Thank you so much, Jessie. Next, I'll be asking Belle a couple questions. So now that we know what AGN is, what main organ systems does this disease affect?
So AGN is a disorder that primarily affects the renal system function, and it also has a little bit of influence in the vascular system. And then the cause, as we mentioned before, it begins with the immune system.
Okay, so you said that it begins with the immune system. Can you tell us a little bit more about that?
So the cause is typically due to dysfunction of the immune system following an infection. And as we talked about before, this bacteria can often be streptococcus. Following the infection of that, the antibodies that are produced will typically combine with antigens and then are normally eliminated in the circulation. But with AGN, there are two theories as to why the glomerulus becomes inflamed and damaged. The first theory asserts that the immune system produces both antibodies and antigens in response to the bacteria, leading to the antibody complexes depositing in the glomerular membrane, causing AGN. The other theory asserts that the antibodies that are produced mistakenly attack the glomerular membranes, resulting in AGN.
Okay, so after the immune system starts the disease process, how is the renal system affected?
So the glomerulus becomes damaged and inflamed by the immune process, and then as a result, the renal system is no longer able to appropriately filter the blood. And then it's also not able to produce sufficient amounts of urine. So albumin, as we talked about before, is an important component in regulating the body's colloid oncotic pressure. As albumin is lost by the glomerulus damaged, its regulation of pressure in the vascular system becomes imbalanced. So as the hypoproteinemia becomes more severe, the low oncotic pressure causes or is overcome by the hydrostatic pressure, and the body becomes edematous. Due to both a combination of decreased urine production, the body becomes hypervolemic and leads to hypertension. So the edema and the hypervolemia can cause this hypertension.
Okay, so now that we know more about how AGN affects the body, what would you say that nurses should look for when doing an assessment?
So nurses should focus generally on getting a health history, patient subjective data, vitals, and then monitoring those vitals. They should also look at the face and eyelids, monitor intake and output, the urine color. A full abdominal assessment is important, and then urine and blood samples if they are ordered.
Okay, so when you're doing these assessments, what specifically are you looking for?
So it's important to obtain a patient's health history because AGN will usually follow an infection 7 to 21 days after. The subjective data from the patient can notify the nurse if they are experiencing symptoms of weakness and malaise. The patient's vitals should be assessed, especially because the disease classically presents with hypertension, and then temperature should be taken to see if a fever is present. If hypertension is present, pharmacological treatment may be needed to prevent further or future adverse outcomes. Monitoring vitals can also give a good indication on how the patient is responding to the treatment. The face and eyelids are assessed for swelling, as this is a later stage of edema with the patient, and it's important to look at the patient for edema because the severity of that can help to identify the progression of the disease. The intake and output for this patient should be monitored since the patient can develop oliguria. And then oliguria is defined as a urine output of less than 400 mils per day or less than 20 mils per hour. And it can indicate that the patient has a buildup of waste products. When looking at the urine, it should be assessed for color. As we mentioned before, it can be a dark or color-colored presentation and may indicate urination of red blood cells. Samples of the patient's urine and blood may need to be obtained during the assessment to test for elevated serum creatine, elevated BUN, blood in the urine, and protein in the urine, and then blood samples can be used to determine the patient's immune function. The abdomen should be palpated when you're doing an abdominal assessment to see if there's tenderness and pain. And then when you're doing that, you should gently palpate and percuss the back if tolerated for symptoms of CVA tenderness.
Thank you so much, Belle, for explaining the different assessments that we'll do. So to close our conference, I want to ask a couple questions to test, see what we learned about AGN. So question 1, Jessie, could you answer for us?
Yeah, absolutely.
Okay, so the question is, clinical manifestations of acute glomerulonephritis includes which of the following? A, confusion, B, hypotension and hypovolemia, C, cold sweats, D, proteinuria and hematuria.
Yeah, so for this one, I would say D, proteinuria and hematuria, because confusion, hypotension, hypovolemia, and cold sweats aren't really symptoms that we talked about. As Belle and I both talked about, you will see blood in the urine, and that cola-colored urine is a key indicator, which is because there is protein and blood in the urine.
Thank you. So the answer is D, proteinuria and hematuria, and it's exactly as you said. And so some of the other signs and symptoms, as we learned, is a cola-colored urine, facial edema, peripheral edema, hypertension, and oliguria. So Belle, if you could answer question 2.
Of course.
Yeah. The question is, a patient has been diagnosed with acute glomerulonephritis. Which nursing interventions will be included in the patient's plan of care? And you can select all that apply.
Okay.
Yeah, I'll just let you answer.
Okay, thank you. So I would be monitoring the patient's intake and output. Like I said, that's important to check to make sure that they're producing enough urine. You also want to collect a urine sample since the provider may order it, and it's a good way to test whether or not they're having those symptoms of urinating albumin or red blood cells. And then I would also want to collect a health history. Just like I said, they might have a history of infection, and then weighing the patient, I think, would also be important because you're going to get a good indication as to how much fluid they have. If they're gaining weight, they're probably retaining fluid. And then the other ones, the heart rate every hour is not as important. And then encouraging fluid intake, that's a lot of fluid to take, so I don't know if I would recommend that.
And the answer is exactly as you answered. A, B, D, and E are important interventions that you'd want to do with a patient with AGN. And just like you said, 4 liters in one day is a lot of fluid, and many times patients with AGN is hypervolemic, like you guys have shared, so too much fluid can cause even further damage. So thank you so much. Here are some of the references that we use, so if you want to look more into it, you can take a look at these. And yeah, thank you so much for joining our conference. Jessie, Belle, do you want to say anything to end?
Nope, thank you so much, and just make sure to look for the signs and symptoms for AGR because it is common.
Thank you for coming.